So when we first see you and evaluate, we're going to listen to kind of what your concerns are or what you'd like to try to change or improve upon. Based on that discussion as well as a detailed exam, we can come up with treatment options, and these may run the spectrum of simple non-surgical things to more complex surgical procedures. Following that discussion, we will obtain some photographs. This allows us to not only document and prepare for the treatment, but also to follow you during that post-operative course. After the whole process is done, it's really nice to go back and look at kind of where you were to where you wind up. That's a great reminder of why we went ahead and did the certain procedure to help address the needs that you brought to us during your consultation. Oftentimes after I see a patient for the first time, they'll go home and think about things and still have a lot of questions. If they do have questions, there's certainly many ways that we can address these. We can address them through email or through MyChart. I really encourage patients to come back for a second visit prior to considering any surgical procedure. This just gives us another opportunity to have a face-to-face conversation and really be very transparent and candid with you about what to expect for the upcoming procedure. And then for some of our larger procedures, I typically will have you come in the day before and I'll actually mark you in the office. There's a couple of reasons that we choose to do it that way. The environment's a little bit less threatening. You know, on the day of surgery, there's a lot of people that are going to want to see you, and it really allows us to have a peaceful time where we can focus on marking you so that we can execute the procedure that will allow you to get the results that you want to get. Secondly, for me, it really allows me to critically review those marks the night prior to your surgery to make sure that everything is just the way we want as we enter the operating room that following day. As part of the preparatory packet of information that you will receive, you'll obviously receive our contact information should you have any questions after surgery. I often call my patients the following morning or afternoon just to check on them to make sure that everything is going well, and certainly answer any questions that they may have immediately following their surgery. I also give them my cell phone number, so if they have any questions throughout the course of their recovery, they can feel free to give me a call. We hope to get the opportunity to see you very soon and welcome you personally to the Department of Plastic Surgery in Frisco.